Hello. So, to continue my previous two videos, now I'm going to talk about the difference in the nutrition of the two families that raised me. So, from my father's side of the family, since they came from a village background, and also because they came also from a poor family, one habit that was there in our family was that most of the men would consume huge amounts of rice. Like in modern day diets, people usually say to consume maybe like 1 cup of rice, but the fathers and grandfathers in our family, I have seen them consume almost 5 6 cups of rice in their meals. Now, this pattern emerged in my family because when they were poorer, when they had less income in the family, rice was the cheapest thing to buy. Like, rice was the most filling food to eat. That's why they ate more of the carbohydrates. And also because they lived a life in the villages where my dad, my uncles, my grandfather, they all used to cycle to work, because of which they needed more carbohydrates to sustain the work that they used to do. While going to school, they would cycle for miles. So, for them, this high carbohydrate intake when they were in their working ages, they needed that high carbohydrate intake. But as my grandparents were aging, their carbohydrate content and needs should have reduced because they weren't doing as much physical activity as they did when they were. For my grandmother, she was raising 5 kids at home, and my grandfather was working outside the home. So both of them had a active lifestyle when the kids were growing up. But by the time the kids have become adults, their daughters have been married, their sons are married or working, at those phases, their physical exertion of childcare is less for my grandmother, and the my grandfather had retired, so his physical activities had reduced as well. So, likewise, their consumption of food should have reduced a little bit, their calorie intakes could have reduced a little bit, because if they had focused on reducing the carbohydrates in their diet, both of them eventually might have had less severe symptoms than what they had when they consumed these huge amount of rice in their diet. And while my grandfather was having maybe like 5 6 cups of rice, my grandmother was having at least 3 4 cups of rice. So they both used to have a lot of rice intake when I was a kid, and I observed them eating the food they ate. Now, for me, because I was growing up in a city life and I didn't have a very active childhood life, I was not a very sport oriented person. So, in my health status or in my family, I started consuming automatically since childhood lesser rice than any of my family. In fact, in my family, I would be teased by many of my family that why are you eating less rice? But the arsenic poisoning that was happening to my grandmother and my grandfather, which led to some conditions, disease conditions later on in their life, that led to their death. Same arsenic poisoning was happening with me, but while I was a child, I didn't know I was having arsenic poisoning. But even if you are a child and you don't know what is poisoning you, intuitively, God gives children or people who are at most distress from something going wrong in society or in their health. Those people have this intuitive guidance sometimes coming from the universe, because that is part of their life purpose. So as a result of my intuitive sense, something related to whatever I was consuming in West Bengal whenever I used to go for holidays, I ended up invariably not eating as much rice as my family. I would always deny eating these 3 4 cups of rice. My dad would also eat, even though in our home he would eat only maybe 2 cups of rice. When he was visiting his mother, he would always eat 3 4 cups more than what he would eat in his normal life in Mumbai. So that happened because, one, your mother is cooking more food, second is out of love you will do it, third is he had that psychological pattern from his childhood to possibly eat this large amounts of rice when he lived in this village. So all these are the factors that influence his eating habits when he's there in that village life. But because I grew up in a different place, even though I might have had the same genetics as them, I still had some differences in genetics, and I still had some differences in social and conditions, which led me to only eat maybe 1 to 2 cups of rice while everyone else was consuming at least 3 to 4 cups or 5 to 6 cups, depending on their if whether they were male or female. Now, in my other grandfather's house, because my other grandfather was slightly more affluent than this grandfather, and my grandfather was also, according to what I have heard, he was a milk commissioner, assistant milk commissioner in West Bengal. So, being the assistant milk commissioner, he also had lived in a village area for a while when he was working as an assistant milk commissioner. And when they lived in that village area, that's why my mom had likely also some village exposure of clean air, clean healthy environment, clean natural surroundings of farming going on in the area where they grew up. But eventually, in I think my mom's youth years, when my uncle was studying and all, they all likely migrated to Salt Lake, which is a city of West Bengal. So when they have migrated now to a city life from a village life, all the things that they were having access to, like cleaner food, fresher food, healthier, clean lifestyle related meat products, all these have now reduced in their life when they are living in a city, because food is now getting transported from the villages to the city. So there is a added layer of pollution that happens when food is being transported. There is an added layer of chemicals that might get added to our meat products, poultry products, when they are getting transported from villages to city. So all these chemicals that are now getting added while food is being transported, food is being stored, food is being sold, all these different stages of the food supply chain also were impacting the health quality of the food that my grandparents in living in the city were having access to. So despite all that, they still lived longer years than my grandparents in the village, was because of one reason being the socio-economic status of both these families. Second reason, because of the socio-economic status, and also because of the kind of work they had done when they were in their young age, in their middle ages. Their work life had also determined certain things related to their health. So my grandfather, who was a milk commissioner, had access to fresh milk, fresh farming more than the grandfather, who still lived in a village but being poorer had lesser access. Or their family would buy because they had limited means. Their family was also a larger family. So the same, if even both grandparents had the same salary, again, if a family of 3 will need less food than a family of 5. So my one grandparents' kids were a family, they were total family of 5, and the other was a total family of 7. But even with same salary, the money would be used and distributed more with a larger family. And here their salary itself was vastly different. So that's why the nutrition that the kids of my other grandparent got, the nutrition that my other grandparents had access to, and the money that they had access to helped them in getting better quality food. But because after my grandfather retired, or slightly prior to his retirement, I don't exactly know when he moved to Kolkata, at that time the access to the fresher foods had reduced. Because Kolkata is a larger city where with more densely populated population, Kolkata's waters are already less clear and less pure than the waters of the village like areas where my other grandparents lived. So these grandparents, that's why, had more bone health problems, because if your water is vastly polluted, then and greatly polluted from decades and centuries of people having inhabited those cities, then what happens is those water, the chemical content of the water itself is different. Salt Lake has a very hard water, compared to other waters in other parts of West Bengal. So that itself influences certain things related to their bone health, because if this, while they boiled this water to cook their food, to drink, while drinking we boiled this water and filtered also the water and took away the hard calcium, magnesium, whatever salt deposits would form on the surface of the water after boiling it, we would filter it out and drink this water. But the same water was being used for cooking our other food, and that was just directly coming either from tap water or from a RO water source. Now if it comes from a RO water also, from my observation of RO filtration systems in recent years, I've realized that RO can purify the water a little bit, but RO systems don't have enough power to filter out everything present in the water. So some calcium, magnesium and other deposits from these their local water supply was impacting their cooking as well, from which their bone problems will come up, because if you are absorbing these chemicals, absorbing other things that are present in this water via the food you're consuming, via the shower you're taking in the same water, via the clothes you're washing, and then those clothes are now absorbing it to your skin, because we wear clothes for the whole day. So anything our clothes get washed in, be it the chemical detergents that our clothes are getting washed in, or if not the detergents, the water itself, if you were just washing your clothes in pure hot tap water, even then the pure hot tap water, if it has some chemical contaminants in it, all those contaminants get absorbed by our clothes. They don't just simply dry off from our clothes, they stay absorbed on the clothes, and from the clothes they have a potential to get absorbed by our skin anytime we are sweating. And that's how, if my grandfather didn't have allergies from soap deposits, he was having allergies from the water pollution related deposits on his skin. And the other thing that happened, which is different for these grandparents, not just the water pollution related elements, because my family also had doctors in the family who were practicing in that home actively, seeing patients from the home. Sometimes they would give vaccinations or medications to people who came to visit them. Sometimes they would give medicines to their parents, to us when we as kids got sick, to anyone in the family who's living there who's getting sick, everyone. Because when you are a doctor, it is a natural proclivity that when you are sick you take medicine. And I have grown up with a family with that attitude. Both sides of my family, mother's or father's side, has grown up with the standard pattern that you take medicines for solving your health issues. Why do you think I became a pharmacist? I was a pharmacist in US because of the same reason, that I have grown up seeing that medication is the solution to health problems. But only in recent years, when I've stopped working as a pharmacist, when I started getting diseases which were not being managed so beautifully or even partly by any medication, that's when I started realizing that there is a flip side to taking medications. There is a flip side to all the chemical usages and consumption that humans are doing in our lives, in our current lives. And because of this current life patterns that we have been engaging in our life, these patterns have to change if we want to stay healthy. Because some of these patterns, even though they have been normalized for decades of our life, centuries of our life, some of it has started to cause health harm and earth harm. Because all these medications that, say in a family, that family itself had family of 9 people living there, and then when vacation time we would be 12 to 13 people living in the same home. Apart from the 9 people living there, there were also sometimes maid servants and nannies living in the home. So usually at least 10 to 11 people were living or working in that home, and then another 3-4 people would visit them during vacation time. And during all these people living in that same home, then for a while they even had some tenants living in one of the lower floors. All these people who were living there, visiting there, staying there, coming as a patient, everyone's medication uses. If after using the medication, what is the natural process of a medication? The medication that we take for a particular disease, part of the medication gets absorbed by the body. From the absorbed medication, you get the medication's impact on our health. While the medication is being also absorbed, part of the medication also goes through the liver, and because there are two phases of absorption, one is absorption in the stomach, second is absorption from the intestine, and in between the absorption in the stomach and intestine is the liver elimination stage, where if the chemical is the body's different enzymes in our liver can convert the chemical into a different chemical in the body, and that different chemical as well as the original chemical can get absorbed in our intestine. And also, if any of these chemicals are harmful for our body, they will, even if they are not harmful, they will eventually get eliminated. Any part of the medicine that is not absorbed will get eliminated via our stools. Then some of the medicine that is absorbed in our body, after its action has been done, it doesn't simply stay in our body. Our circulatory system is constantly circulating chemicals in our different organs. So as a result, the circulatory system is also supposed to take up these remaining chemicals and take it to the kidneys, and from kidney also some of the drug will be eliminated. Then the third way where the drug can come out from our body is via sweat. When we are sweating, some of the drugs that we have absorbed, and if they are water soluble drugs, they will also get out via the sweat. So the body has different systems to eliminate a drug, because a drug is not a natural, most drugs are not natural chemicals naturally aligned to our body's functioning chemicals. They help our body in functioning in particular ways, but because these chemicals are not natural to the body, they eventually have to be eliminated from our body. But when someone is taking medicine for years and years, what is happening is a lot of medication is building up in their body. When a lot of medication is built up in their body, that also means a lot of medication is coming out via sweat, a lot of medication is coming out via stool, coming out via urine. So all these elimination things that are happening, they can also come out via cough. If you're coughing out something, some medicines, if they are stuck near the respiratory tract, they might even come up from cough. So all these medicines that is coming out from the body, is it just simply disappearing? It is a material thing, right? So the material thing doesn't disappear. These chemicals that are passed out from sweat will go into our clothes and again get reabsorbed from our clothes back into our body. Some of the chemicals, if you have an elderly who's taking a lot of medicine and is also sweating, and the chemicals are coming out from their body, or they have chemical poisoning happening from their water pollution in their homes, these chemicals are coming out from the body. And if that person is now holding a child, holding a baby, because grandparents do child care in India, even if you don't do child care, sometimes, because you're elderly, you love hanging out with children. So when you're holding a child, if any chemicals, poisonous chemicals are there in your body, that will now get transported to the child also, if you're holding them via absorption or simply via your clothes touching their clothes, and then the child might absorb the chemical from their clothes. So like that, any chemical that is continuously being used in any place of the world, be it a small home, be it a workplace, be it while we are traveling, we are getting some exposure to some chemicals. Our body is constantly in a absorption state, inhalation stage, constant working phase with the external environment wherever we go or live or work. So because of which, in the modern life, all of us have the tendency to absorb and inhale and get exposure to different chemicals that are being sprayed for whatever purpose they are being sprayed. Someone could be spraying a hairspray in a salon. you can inhale that and you will have some effect from that, even if you don't use hairspray. If you are going via train, and the train or a plane or a cab, and the cab driver, train maintenance crew, plane maintenance crew have been the protocols to spray air fresheners or pesticides in their trains and planes, all of these chemicals are also getting absorbed by you. That's why during COVID travel was banned, because if you, even though people don't understand the higher purpose of the travel ban, this is the higher purpose. Because while traveling, you are absorbing every kind of chemical that you are getting exposed to while traveling. At least when you are at home, you are exposed to only the limited number of chemicals that your home or city people are using. But when traveling, apart from your home environments or work environments chemicals, you're also picking up the travel environments chemicals in your body, from your food, from the air, everything, right? So for my grandparents, now coming back to their health status, they were like this because it was a family where lots of medicine was being used. Now the medication that is eliminated from grandparents, children, parents, anyone who is using the medicine, all those elimination impact of the medicine, whatever got eliminated from the body. If you sweat and you went and took a shower, again the shower water now has, sewage water has the chemical. If you went and sewage water essentially is having the chemical via your sweat and shower, or via when you went to the bathroom to do your number 1 or number 2, right? So all these, where are these chemicals going? If some city has designed a pathway where their sewage is going and draining in a particular place in that city, then that place has the most chemicals now. But if people's homes have a drainage system where the drainage is happening just near their home, just besides their home, just in the neighborhood of their home, or in underground areas of that same home that was built, then the chemicals are there in the water and soil of that home. Now that chemical being there in the water and soil of the home, what happens then, which happened in recent years during a thunderstorm, some of the trees in West Bengal are falling. Not just West Bengal, I saw some trees in West Bengal that had fallen and broken, some trees in Navi Mumbai also, where a lot of chemical pollution is going on from pesticide spraying and other chemical activities. But pesticide spraying is the one which is controllable and manageable first, because it's the most observable one. So and there is a step-by-step thing humans have to do if they want to become healthier, by slowly eliminating each toxin from our environment. So for my grandfather's home, their trees and plants were dying. Some of the trees and plants started, if not dying, they are having a slow, painful death, whose impact, like how all these chemicals impacted my grandparents, after 10 years of exposure, 20 years of exposure, 30 years, depending on how many years they had exposure to the same chemicals, their health slowly deteriorated over time of use of those chemicals and exposure of those chemicals. So same way, all the medicine also that is going in their underground water supply now, even if the water supply's pump has a filtration system to filter out many things, even if the RO system has a system to filter out many things, RO systems and filtration systems don't have the design to filter out molecules of chemicals from the certain molecules might get filtered out if they are large enough in size, but if they are tiny molecules, some filtration systems won't be able to filter it out via the devices that we use. Which is why it is important that people have to now start realizing how important it is to stop water and earth pollution. And the only way we can stop water and earth pollution is by step gradual decrease in the chemical pollutants that our body has got used to. And there is a second component why we have to do a gradual decrease, is because our bodies are now, some of our bodies who are getting unhealthy, who are getting diseases, who are starting to see the symptoms, their bodies are completely overwhelmed with the chemical toxins and other toxins from their environment. It is not just chemicals, there are other factors also impacting our health, but for the sake of this video I'm talking about the chemicals. So when chemical poisoning is happening via different sources to our health, those whose body are already toxed out, whose organs have already started getting damaged, whose circulatory system, cardiac system, respiratory system is beginning to start showing some distress, who might have started showing cancer as a result of chemical exposures and other carcinogenic elements present in their environment. Now these people are the weaker members of the society, just designed to help other people in their family, other people in the society, other people in the community wake up to what is wrong in the environment. Erin Brockovich, when she did the Erin Brockovich movie, or when she went and investigated what she was investigating, she did that because she observed that the health of so many people was so much worse in her neighborhood. Once she observed that, she had the time to go and resources, because she was physically healthy, possibly she had the determination to find out what was going on, she had the brains to figure out what is going on. That's why she connected the dots of what is happening to so many people. Like that, there's always someone, one or two people, 10 or 20 people who can start observing first what is going wrong in the health trajectory of a particular neighborhood, particular society, particular nation, particular culture. Because if you are an observer, you can observe it just via observational things that have been going on for decades. All these things that I am narrating, is it a new thing? No, my grandparents died in 1990, from 1990 to 2000s. That is the time frame when all these grandparents died, in the time frame of 15-20 years. And in these 15-20 years of time frame when they passed away, whatever was impacting their health in those years, now another 15 to 30 to 20 to 30 years have passed since they died. And in these years since they died, what has changed is more chemical pollution has been added to every element of our life. We are using more and more chemicals, which was okay when the earth was clean and pure. Using a little bit of chemical wouldn't harm people that much. That's why only few people died, or few people were getting the diseases in such slow poisoning levels that their diseases were manifesting as a particular disease condition in their old age. But now the pollution is so high that the diseases are manifesting not in old age. We are also having children born with congenital defects. We have also children who, even if they are not born with congenital defects, after being birthed, they are getting cancer and organ damage and organ failures. We have children, not just children, any age, from young kids of small baby age to elderly of 70-80 years of age. If water pollution, air pollution, food pollution is present in our environment, they are all impacting our health. And just taking medicine right now is slowly becoming a less beneficial option when someone's system is overloaded with chemicals. If I had optimal health, I don't have too much chemicals in my body can withstand taking some chemical drug to help me alleviate some of the symptoms, to help in, if you are getting cancer, to break down the cancer cells and things like that. But if along with that I do not have health supportive factors, if while even consuming that medicine, the water that I need for consuming the medicine is polluted, the water that I need for bathing and keeping the fever low is polluted, the water that I need for drinking my nutritional drink is polluted, the water, the air that I need to breathe and give good oxygen to my body so that all the cells can be healthy, if that oxygen limit an amount is only reduced in the air, I can't breathe. If I drink water, the water is polluted. So will I have a remedy, or will I go towards worse trajectory? Because as a result, so the doctor can tell me take this medicine and mix this in water and drink it, but I can't drink that medicine if the water is polluted, or even if I drink it also, now the medicine is polluted. There are also so many elements to medical manufacturing, food processing right now that is polluted in such levels that if people don't slowly start working on these pollution paradigms of their own work industries, they are causing self health harm as well as long term health harm. And it won't matter how much money you have in the world, how much access to doctors and medicines you have in the world. My grandfather, grandmother, all these four grandparents had access to healthcare. Just one had little less access because they were poorer, so they had some poor access to healthcare. But even then, that's why they passed away a little bit, a decade earlier than the other grandparents, or a half a decade earlier than the other grandparents. But despite that difference in passing away, main problem of both of their health was the same, that root cause of what was causing them to fall sick didn't go away from their life. So even though they were taking medicines, even though some of them took medicines and got the right medically known interventions of that time, even then that was not enough to keep them going and keep them healthy for a long time. Only one of my grandparents stayed healthy for a longer time because she was slightly more mindful, also because she had slightly more mindful caretakers at home, also because that was maybe her journey, because she had eliminated many things from her life. She was a very spiritual person, so spiritually she had eliminated certain things that could aid poor health. She was also, because she had good caretaking kids and grandkids, that helped her in keeping her alive a little longer. But even then her life was still painful in the last few years, because her bone and her body was broken down from the chemicals itself that were present in that environment. The same chemicals, even though she has passed away, those same chemicals are now impacting the health of the next generation, who still live in that house, who still live near that house, who still live in those same cities, because some of the environmental factors were right there in the house that were impacting someone's health. Some of the environmental factors are right there in the food, water, air, which is common to a particular city. Some of the health impacting factors are also related to thoughts, also related to how we live life, what we do in our life. So many factors influence our overall health trajectory and overall good or bad health. Now it's our choice. Do we want a slow, crawling, painful death, just taking medicines to extend our life for many years or decades, but not having any quality of life in a way that you can call a quality of life? Or even if you don't get medicine because you keep going from doctor to doctor and doctor thinks you have a mental health illness, which is what happened to many women I read in the patient story blogs and posts that are there on YouTube. You can also read it and this is happening in a country like America, where in America the healthcare systems have been most studied, most researched, most continuous research post drug delivery is also done than anywhere in the world. And I've worked in US healthcare system, that's why I know how US healthcare system works. And despite all this tracking, despite all this medication use, despite all the interventions being taken to help people become healthier, stay healthier, remain disease free, the main reason why people can't do any of these things is because we have to reduce the pollution and contaminants in our life that causes us to fall sick. Chemical pollution is the first step. When you are taking medicine, understanding whether the medicine should be taken, not taken, is also another step that has to come into play now when chemical pollution on earth is high. And if you have any questions based on what I presented in this video, please post a comment drop a comment, and I would be happy to address some of your questions, because this is a confusing topic. It is a change in healthcare patterns related topic, change in nutrition patterns related topic, which is not very easy to grasp if you first don't have the fundamental understanding of what is going wrong with your health or anyone else's health in your life. And that deeper understanding is needed for us to make the right shift and right changes. So if you have any questions, please drop a comment, and I hope this was insightful to you. Thank you.